All right. Okay. Well, welcome everyone. Thank you so much for joining us. We are here to talk about the Michigan Medicine Field Placements for students that are going to be starting field in fall of 2025. And I am here. My name is Amy Van Tyne. I use she, her pronouns. I am one of the field faculty, one that works in large part with Michigan Medicine, along with my colleague, Amy Brandt, who is also on this meeting. And she is going to be monitoring the chat and trying to help answer any questions there. But she and I are both here. We are both Amy's. That was not a prerequisite of field faculty working with Michigan Medicine. It's just a coincidence. So we made sure that we spelled Amy a little differently from one another. But um, we are also here joined by our wonderful peers and colleagues from Michigan Medicine. David Fulkerson, who's one of the managers at Michigan Medicine and director of the student program, and Melinda Dobine, who's the program manager for the student program at Michigan Medicine. So I'm going to be talking a little bit about the school side of things with Michigan Medicine specifically, and then I'll be handing things over to them to talk to you really specifically about things at the health center there. So I hope many of you were able to join us for the more general hospital-based field placements session that we did last week. If you were not able to attend, the recording is supposed to be up on our website. So please do take some time to review that. The slides and the recording should be on there to give you some general information about hospital-based placements in the field office. But this is our agenda for how we're going to be spending this time today that is really specifically about Michigan Medicine placements only. So we're going to talk about the Michigan Medicine field application process. Want to talk through about things that are really important for you to be considering if you want to pursue a placement at Michigan Medicine and what some of the expectations are. Things are a little bit different with placements at Michigan Medicine than they are more generally for many other placements. So we want to be sure that these are things that you're considering as you're making your decisions. And then, as I said, we'll hand things over to our colleagues from Michigan Medicine to talk about the Michigan Medicine student program. They'll talk about some of the placements that are available for fall and some keys to success. And then we will conclude with time for questions and answers. So that's how we will spend our time. So wanting to talk about from the School of Social Work, our Office of Field Education, the specific dates around field applications. So for fall start students, we do not have a different timeline for our Michigan Medicine applications. You will be applying for field at the same time that all students are applying for field. And our field applications open on May 12th. Field applications are due May 23rd. So you have that time between the 12th and the 23rd to be taking a look at our placement dashboard, looking at what all the options are. All the placements for Michigan Medicine will be listed in the placing dashboard. So you have a chance to look through those, read the placement descriptions, and you'll have a chance to look at other placement options as well that are not Michigan Medicine. So take time to take a look at those things, be really thoughtful about the choices that you're making. Know that it's not a rush to submit your application. Our applications open May 12th. If you submit it on May 12th, you have no greater chance of getting your placement than somebody that's submitting their application on the 23rd, because we're not going to be moving any applications forward until after our field applications close. So we don't want you to feel that you need to rush. It's not going to benefit you to get things turned in immediately. So please take time to really peruse through things and see what what feels like good fits for you. Once you do submit your field application, again, we will be starting to look at the applications after the 23rd. And we review all of the applications to see what your application says in terms of your goal statement and that you've included your resume. And based on what your goal statement says, with the placements that you've selected for some of your top priorities, does that really feel like a good fit? And if so, we're going to move your application along to the placement of your choice. If we have any questions, if Amy or I or any of our colleagues that happen to get your field application feel like what you've written in your goal statement does not seem like the right fit for the placements that you've identified, then we might reach out to you to talk through things a little bit more too. So we use some of this time after the 23rd to our kind of end point where we will have sent all student applications out by June 6th to a choice that a student has. So we might take some time between the 24th and June 6th to be reviewing applications and maybe reaching out if we have some things to talk with you about. Our goal, though, Amy and I have a goal for any Michigan Medicine placements that students are identifying to get those sent as quickly as possible. So our hope is that before the end of May, before June 1st, that we will have our applications reviewed for Michigan Medicine. So again, we have a little bit of a buffer worked in here, but we do work to get those things sent over to Michigan Medicine as quickly as we possibly can. When we talk about your goal statement and resume, again, what you need to do for Michigan Medicine is the same as all the general information that you have for all students that are applying for field. You'll have, for a goal statement, a 1 to 2 page written statement that we share. We send these directly to all of your field placement options. One at a time. We send one placement at a time, but this really gives prospective field instructors an idea of what your interests are and what the things are that you're hoping for, that you're interested in having some experiences with in your field placement. We really want you to follow the goal statement guidelines that we have provided for you. And we do want to encourage people. Sometimes writing is not somebody's greatest skill. And so being able to connect with our skill studies coordinator at the school to get some writing assistance can be really beneficial, really helpful. So we want to really encourage you to do that as well. Your resume, again, nothing unique for your Michigan Medicine field applications. It would be the same resume that you would be preparing for any placement that you'd be interested in here. We do want to make sure that if you have any social work-like experience, that is something that you're emphasizing in your resume. That's something that can really draw some attention to a prospective field instructor and have them have a stronger interest in a student if they've had some relevant kind of experience that way. If you don't, that's certainly okay as well, but we just want to be sure that you'd be highlighting that. We want to make sure that on your resume, you are using your UMich email. Sometimes students have a different personal email that they like to include in a resume, but our field instructors and as we work with Michigan Medicine, we're always using a UMich email. So be sure that you have that on your resume and that is what you're checking on a regular basis. This is how we are going to contact you from the School of Social Work. This is how Michigan Medicine would be contacting you. So be sure that you're checking your UMich email frequently. And our career services here does have some information about creating a resume as well. So please use that resource as a helpful tool as well. When you're completing your field application, even if you have a strong, very, very, very strong interest in being at Michigan Medicine, we want to encourage you to think about if you want to list a top choice, because you have three potential placements that we want you to prioritize. What are your top 3? If your top one is a Michigan Medicine placement, that's great, and we want you to include that. But what we want to have you avoid is to put all 3 of your top choices as different Michigan Medicine placements. And the reason that is because we send all of the Michigan Medicine applications out at the same time. So if you prioritize your top 1, 2, and 3 as Michigan Medicine placements, as long as everything looks good for your first choice, we're going to send that to your first choice. But we also are sending other students to what your second choice was and what your third choice was. So by the time, if you don't happen to get your first choice, by the time we're then circling back to see about your second choice, there's already been a student that's been working on that one. So we want you to consider placements outside of Michigan Medicine as well. If a student does not get their first choice placement at Michigan Medicine, we are working along with Melinda and David on what are the other available options at Michigan Medicine. And we will always work directly with a student after they haven't gotten a first placement choice to be able to say, here are some other options that you might want to consider. So again, while we always have students that want to list multiple Michigan Medicine placements, we really want to encourage you to diversify a little bit more just to give you the best chance for some of the other placements that you may be interested in as well. We really want you to, in your goal statement, to emphasize that you have an interest in why it is that you have an interest in working in the healthcare area. Maybe emphasizing if you're really interested in working on an interdisciplinary team with colleagues from other backgrounds and disciplines. Those are some really great things to be able to highlight. And as you're writing your goal statement, we want to encourage you to write it in, while we want you to be specific about your interest around healthcare or interdisciplinary work, we don't want you to be so specific to say, I want to work in oncology or I want to work in inpatient psychiatry, because if you don't happen to get that placement, we don't want you to have to rewrite your goal statement. So being able to speak to your interest in the healthcare realm is great. But if you become so specific about your top choice placement, it may be that you'll have to rewrite that if for some reason you don't get that first choice placement. And finally, and we talk about this in the general health hospital field meeting that we had last week, but we want you to refrain from sharing a lot of detailed personal history. Oftentimes people have an interest in working in healthcare because they've had a personal experience, either their own healthcare needs or someone that they care for, and that has really drawn them to working in healthcare. Sometimes that can be a little bit of a red flag for people as they're reviewing student materials to say, okay, this person has this really personal connection to this. Are they going to be really ready to do the work of a social worker here? And so sometimes that can make people pause a little bit. So while you may have a personal reason, a personal connection why this work is why you're really drawn to this work, what we really want to encourage you to do is really talk about it again in more general terms so that there's not that there's not something that is making people feel a little bit cautious about and questioning, are you actually ready to be in this area if what you're focusing on is the personal experience. So again, just some highlights that we want to remind you about as you're completing those materials. So what happens after you apply? Again, please check your UMich email regularly because this is how you're going to be getting your information. So your application is going to be reviewed by field faculty first after you submit it. If we have any questions, we're going to reach back out to you to either make any edits or changes to what your application has said. If everything looks good to go, we're going to just go ahead and move that forward to your placement. We're going to send that resume and goal statement to Michigan Medicine. And Michigan Medicine then would be reaching out to you directly to either schedule an interview if the field instructor would like to offer you an interview, or they will let us, the field faculty, know if an interview is not going to be offered at the time. So again, be checking your UMich email to be able to have that information. And then whether if you have a placement that's offered to you, that will be great. Congratulations. You would get a message directly from Michigan Medicine confirming that that placement has been offered. And then I would also send something, or Amy would also send something from the school also confirming that the placement is set. If the placement is not offered after an interview, and that happens because there's a lot of interest in Michigan Medicine placement, so often students will interview very well for a placement, but they just have multiple students that have been interested in a particular spot. So it doesn't mean that a student can't get another really good placement either at Michigan Medicine or some other healthcare entity. But we will share any feedback with you if we receive that from the interview as well. And then we will work with you on what the next step will be. So things to consider regarding Michigan Medicine. Again, Michigan Medicine placements are not guaranteed. So while we're excited for you to be interested in Michigan Medicine, we want you to look at what those options are. Know that there are a limited number of placements available at Michigan Medicine, and that if you don't get your first choice, we will work with you to see, is there another choice at Michigan Medicine if you'd really like to be there that could be a good fit? And if that's not the case, then we will look at what other options there may be. Again, Michigan Medicine placements are all being filled at the same time. So we want you to diversify that application selection. Think about things outside of Michigan Medicine that may be of interest to you. And if you are really interested in Michigan Medicine, sometimes for our students that are in a more micro-focused pathway, like the older adults pathway, child welfare pathway, or interpersonal practice pathway, sometimes there are some macro placements at Michigan Medicine that also offer a lot of micro work. And so we have been able to have some students that are more micro focused in their pathway be able to be in what's considered more of a macro placement, but there's enough work opportunity within that placement that they can be in a macro, it's like a hybrid kind of placement where they're getting both micro and macro experience in that field placement. So that may be something to consider. Michigan Medicine placements are 24 hours a week. So students are needing to use additional credits for field. They use some of their elective credits for additional field time. That's something that we can definitely talk through with you. If you are offered a placement at Michigan Medicine, we can talk through with you how that works. We have students do it all the time. But what generally happens is that students have to use some of their elective credits, which means they won't take as many classroom classes because they're going to be using some of those elective credits for additional time in field. We have always heard students say it was a great investment of time to have this additional time in field, but that is something for you to consider as you're making your choices as well. If that were to be the case, there's a process that we would need to work through with you. And again, Amy and I would talk that through with you in terms of how do you now change your schedule because you'll be in field additional hours than what you had intended. It's also important to remember that in the vast majority of cases at Michigan Medicine, placements are 3 consecutive semesters. So sometimes when students are going to have a break between their semesters, Michigan Medicine may not be the right placement. And I say in the vast majority of cases, because we've had a couple of situations based on what the placement itself is, more macro placements that students maybe have been able to be in a different schedule. But in the vast majority of cases, these are placements that are 3 consecutive semesters. If you are, if your class schedule right now is different than that, so generally speaking, we say if students are in like a 20-month schedule where they're going to be off for a particular semester, don't change your schedule now. If you still want to pursue a Michigan Medicine placement, we can move forward with that. And if you are placed at Michigan Medicine, we can work with you on making a change to what your schedule is after. So please do not make any changes to whatever schedule you have now. That's something that we would work through once a placement is confirmed. Students will participate in the student program at Michigan Medicine if you're placed there, and Melinda and David will talk more about that. It's important to know that that student program has a set schedule, and all students are expected to actively participate in the student program. It's one of the huge benefits of being a student at Michigan Medicine. So it's important to remember that the student program meets on Thursday mornings in the winter and summer semesters and on Tuesday mornings in the fall semester. So whatever schedule you need to be figuring out, you would need to have those times blocked off for the student program. And also, as a reminder, all students in Michigan Medicine placements, as well as all healthcare-based placements, are expected to take the IPE team-based decision-making course that's held in the winter semester as well. So those are just some reminders from the hospital-based placement also. So again, we will do time for question and answer at the end, but I would like to turn this over to David and Melinda, and thank you for joining us tonight.
Thank you, Amy. Good evening, everyone. My name is David Fulkerson. My pronouns are he, him, and I am the director of the field education program. Melinda, you want to introduce yourself?
Yes, I'm Melinda Dovine, use she, her pronouns, and I'm program manager. So I am the one that puts together your schedule and be that contact person between whatever you need is what I'm there for. And if I can't do it for you, I'll tell you. If I don't know, I'll figure out where we need to go and where to get the answers and that sort of thing. So I'm your point person.
Absolutely. So, like Amy said, we have a brief slide deck to go through. I'm going to go through the first part. Melinda will take the second, and then we will have plenty of time for question and answers. Amy, can you thank you. Oh, another beautiful picture of our campus. All right, so what do we offer? Our placements at Michigan Medicine offer an array of didactic and hands-on experiential learning opportunities. So like Amy said, our placements are 24 hours a week. And then just to expand a little bit about that set schedule. So as an example, fall will be Tuesday mornings. So that is the set part, is that Tuesday morning bit. where we have our weekly mentorship courses. You see here on this bulleted list, we have weekly mentorship courses and then weekly workshops and seminars. And then throughout the semester, sometimes those workshops and seminars will include other specialized things like clinical skills training series, interprofessional education experiences where we partner with other disciplines like the School of Nursing students, nursing students, students from the School of Pharmacy, medical students, things like that. The clinical skills training series is an opportunity for students to partner with, kind of separate out from your primary field instructor, and in a small group environment, learn how to do psychosocial assessments with a different field instructor in a medical setting for one rotation, then in a psychiatric setting for a different rotation. So those are the types of things that you would be doing in that set schedule on the Tuesday or Thursday mornings. And that's something that you all the students do together as a cohort each semester. And then the rest of the 24 hours in the week is spent with your field instructor, your primary field instructor, doing field work as assigned. So you would kind of figure out those hours as you go, and then have that set schedule typically for the entire semester, with some, depending on the instructor and on your placement, there might be some flexibility in that, on a week-to-week basis. But typically, because you're working with patients, you're working with other teams, that schedule is pretty consistent. Also, because you have classes every week that are consistent, that schedule is pretty consistent. And then, as you can see here, we also have social justice grand rounds, interprofessional education social justice grand rounds, and All Women Are Leaders series. So those three things are opportunities for students, if they are interested. This is not a requirement, so you don't have to do this. But we encourage students, if they have an interesting case, an interesting patient that they worked with throughout their experience. So this isn't something that you would do your first semester, but perhaps in your second or third semester, working with your field instructor and then working with an additional mentor, you would develop that case into a presentation that you would then stand in front of the entire social work department and your fellow students and present with a panel of experts that you would choose and work with to develop a presentation in a grand rounds educational experience. So that's the social justice grand rounds. The interprofessional education version of that is very similar, but we partner with the School of Pharmacy to choose a topic that is interesting and for both student cohorts. And then the All Women Are Leaders series is, again, a variation of that Grand Round series, specific for identifying topics and students who are working in those spaces and who have demonstrated leadership in their previous work and or in their current field experience. Next slide. So, and then these next few slides, we're just going to talk about some specific areas where we have field opportunities. So the Department of Social Work is one primary area in the health system. And then we also have the Department of Care Management, where we have field instructors. There are other small areas where we have field instructors, but those care management and social work are the two primary areas. So the inpatient care management social work consists of the social workers, the field instructors in those areas do clinical social work with patients in inpatient areas. And then they also are responsible for discharge planning. They function as clinical members of the interdisciplinary team with nurses, physicians, so nurse practitioners, physician's assistants, dietitians, physical therapists, occupational therapists. If you can think of a role in the hospital these are the social workers that are working with those members of that interdisciplinary team. So each unit in the adult and children's hospitals have an assigned social worker. Also we have the emergency departments. We have children's emergency department and adult that are staffed 24/7. Don't worry, we don't expect students to ever work 24/7. That's not something we do, but we do have social workers who work those shifts. And then the caseload and patient population varies by unit. So it can be general medicine, it could be post-surgical, pre-surgical, specialty care, various intensive care patient populations. It could be geriatrics, it could be neonatal, it could be intensive, burn unit, etc. Opportunities for learning and the work would be completing biopsychosocial assessments to assess for psychosocial needs. You'd be working with your field instructor to determine if there are barriers to care, working with the patient to determine, what things are going to look like post-discharge. Is this patient going to what does the home look like when they get out of the hospital? Really, the goal is a successful discharge. We don't want to have bounce backs. We want them to have an appropriate level of care post-discharge. And that is the social worker's, a primary part of the social worker's job. And then also providing social work interventions throughout a patient's hospitalization. So assessing for anxiety and then working with the patient on an intervention. So brief interventions, certainly, right? Patients in an inpatient space aren't there for long enough where we can do a 12-week course of CBT, but we can certainly have an opportunity to do a brief intervention to work on anxiety or work on a brief intervention for acute depression, things like that. So a lot of opportunities for very different work in that care management space. And then on the inpatient social work side, we have all of these different roles and pieces of work that we do: substance use assessment and intervention, responding to codes, crisis intervention, assessing for home safety, suicide risk assessment. We have specialized teams in palliative care, both in adult and pediatrics, grief and loss support. We'll talk a little bit more about specific programs that deal with grief and loss support, intimate partner and domestic violence, mental health concerns, resources, working with assessment, and then working with community partners in terms of homelessness and housing concerns, helping patients connect with community resources, legal custody concerns, Make-A-Wish, Rainbow Connections referrals for pediatrics, post-hospitalization facility placement, assessing for abuse and neglect concerns, and then working on interventions for those if those concerns are met or turn out to be justified, financial concerns assessment, and again working with community partners for interventions, complex adjustment, family adjustment, prescription assistance. Sometimes we can work within the health system for that. Sometimes we're working with community partners, insurance concerns. We can work with our patients to, for Medicaid enrollment, Medicare enrollment, things like that, guardianship, durable power of attorney, helping patients get durable power of attorney if they don't have one, advanced directives, transportation needs. So lots of opportunities for learning and exposure to so many areas that, really outside of health systems and outside of medical social work, you really don't have that opportunity to really have even awareness of these areas. Next slide. And then our general medicine units encompass a wide variety of patient populations, like I said a few slides ago, a lot of presenting medical concerns. Some common social work interventions can include substance abuse or substance use disorder, mental health, homelessness, home safety, intimate partner violence, behavioral concerns. And then when I was, just to provide some more details on discharge planning, it could include hospice care. So maybe there needs to be a higher level of care before the patient can go home. So that could include hospice care. It could include long-term care. It could include a short-term rehab care, memory care, group home. Maybe the patient can't go return home, and homeless shelters. Slide. Uh, Also, just a little bit more detail on our surgical and specialty units. The social work role is similar to general medicine, but with the addition of specialized services and programs related to these populations. We, including neurology and neurosurgery, otolaryngology, cardiac surgery, cardiology, ortho and trauma surgery, hematology, oncology, and pulmonary and transplant. So a lot of different areas. And as you might imagine, some of these patients in areas you might have a very short-term experience with this patient, and some where in transplant you might have a very long-term experience where you're doing a transplant assessment with your field instructor, and then you might work with that patient throughout your entire year or your entire internship experience. Same thing with pulmonary, where they see a lot of patients with chronic illnesses like cystic fibrosis, where you might work with a patient for an assessment and then work with that patient for the over the long term. Whereas in other areas, you might only have of an assessment and a brief intervention with that patient. So, and then same thing could be true in pulmonary as well. So there's a lot of variety and a lot of opportunities for learning in really in all of the medical spaces. Next slide.
Okay, thanks, David. So I'll go over the remaining placements that we have available. This is a psychiatric placement for adults, and adults is 18 and over. Just like the medical side of care management or on your general medicine floors, biopsychosocial assessments are very similar. You will probably focus more on the psychiatric part of it in a psychiatric rotation, but the biopsychosocial assessment is pretty similar across board. You would also have that opportunity for, doing therapeutic interventions, like whether that's individual, family, um, or group work. On 9C. Their interdisciplinary team includes med students and the psychiatrists and the residents. So there would be a lot of contact with the other disciplines on that unit. The social workers focus a lot on discharge planning, making sure that the patients are set up with a discharge plan to prevent rebounding back into the hospital. And it's a very short stay. On average, patients are there for about 5 days, if that. So it's a very quick turnaround. Um, there's a lot of family work that is also done from a psychoeducation standpoint. So this placement on 9C is very quick, very quick. Next slide. Adult ambulatory psychiatry is more like your outpatient care, and you're likely to follow approximately 5 patients a week, do their psychosocial assessment or their assessment, and being more familiar, getting more familiar with the DSM-5, their interdisciplinary team there as well. Without an interdisciplinary team, it's hard to really treat the patient as a whole. So you'll see that regardless of, where you're at in our health system, there's always going to be that multidisciplinary team. So you'll get experience with, writing up your clinical impressions and doing documentation. Next slide. Child and adolescent ambulatory psychiatry is the same, other than the population is different. And you're working with minors and families at that point. Next slide. UMATS is another outpatient psychiatry, under outpatient psychiatry that focuses on substance use. Again, there are those weekly sessions. They also have their group therapies are more like intensive outpatient programming. I did forget to say the for the child and adolescent or psychiatry, there is a partial hospitalization program for eating disorders that is available. And then we're in the process of getting a psychiatric adult partial program up and running. Unfortunately, that's not available for you all, but it'll be a resource that you will become familiar with that can, depending on where you may be placed, would be a resource to meet the need of a patient. But for UMATS, it's definitely focused on substance use, and it deals both with adolescents and adults. Next slide. Our hybrid and macro placements. So hybrid really means that some of the placements will have both a virtual component as well as an in-person component. So when you're, and that should be on the placement description as you all read those off the dashboard that you will look at. So just be mindful that if you're wanting a fully in-person placement, then, when you look at it, make sure that it does say that. But we do have a couple that are hybrid. Macro placements are the Office of Decedent Affairs, and they do a lot of programming around grief. Also, helping family members deal with loved ones that have passed on and providing them that support. The Michigan Oncology and Quality Consortium is another one that deals with, providing care to cancer patients. We actually had one of our social justice grand rounds about Michigan Oncology and Quality Consortium and financial toxicity. So that program really works to try to ensure that cancer care can be accessible to all patients, regardless of means. And then the Michigan Medicine Social Work Education Program, that would be a macro placement that is hybrid as well. And I would be the one that the student would be potentially working with, and how to put these schedules together, your training schedules together, making sure that all the instructors and the students are all on one page, and just providing that support. So we do have a few macro placements where our goal is to try to increase that, because we have heard that students would like to see more macro placements to choose from. So that is what we have right now for placements. And is that you, Amy, or that me? Can't remember. So key to success is really the commitment to learn. Come in humble, showing humility and openness to hear what we have to offer. I find that that's the best way for people to leave feeling like they gotten something out of their placement. Um, it is a very diverse educational experience. As you can see, there's social work roles are in every crevice of the hospital. If you can think of something, we can do it, right? So just be open to, learning from others. It will be a key to your success. Professionalism is also very important. I'm sure some of these things you've all heard about, but it doesn't hurt to reiterate it. It's definitely um, important that we continue to practice that. Regular and open communication with your um, field instructors or me or David. My belief is that when people are silent, you don't get heard and we don't know what to do to help you out. So we foster, I value open and honest communication. That's the only way to make things better. Um, and your willingness to challenge yourself. There's going to be a lot of challenging moments, but um, I think challenges help us with our critical thinking and help us in terms of thinking outside of the box to come up with a plan. Next slide. So we have any questions for?
Thank you so much. I'm gonna stop sharing my screen now if I can figure out how to stop sharing it. Thank you so much for sharing that information. And I want to give us a chance to be able to do questions. My computer is just not cooperating with me here. But what I'd like to say is, here we go. What I would like to say is if you have more general questions, I'd like to start with those first. If you have things that are really specific to maybe your own unique situation, if we can hold those until the end so that people can log off if they feel like their questions have been answered, that would be great. So, Amy, maybe I'll check first. Were there any questions in the chat? No questions in the chat. Okay. So anyone that has general questions, if you either want to use the raise the hand in Zoom or you can unmute yourself to ask a question. All right, Sage.
Hi, thanks so much for the presentation. So I was just wondering generally, what would you say is the difference between being in a hospital environment versus being in more of a health clinic, like organizational agency environment? How could that maybe feel as a student and just, yeah, kind of the general differences?
Yeah, I don't know oh, David, did you want to answer that?
Yeah, I mean, I've never worked anywhere but this particular health system, but I have worked in several clinics and the hospital itself. So I guess I would say just in terms of, and then, Melinda, I think you've had a more diverse working experience, so you might be able to answer as well. I think the hospital offers certainly faster pace experience, and there's a lot more energy, definitely since the pandemic, where I've noticed a lot of the outpatient clinics tend to be a little bit more subdued these days, whereas the hospital retains just a lot more high energy feel to it. I would say also that you have a lot more opportunities to interact and learn from more people. So not just your individual field instructor or your individual team, but just because there's so many, everything is so close together here. You would just naturally in your day-to-day work, you're going to interact with other teams, with other professionals, with other social workers, You're going to get to know other people. And that's going to give you opportunities that you wouldn't have just to be exposed to new ideas, new ways of being a social worker that you might not have considered, which honestly can be a little overwhelming, at times. And it takes a little bit of, when I was a student, when I was an intern, I kept struggling. The thing I kept struggling with was I don't know what I want to do. And all of these things are so exciting and interesting. How do I choose? And that's something that took a little bit. Now, luckily, by the end of my internship, I had figured it out. But that was one thing that I think was both a little bit of a positive and a little bit of a challenge. And I was an intern in the health system here. But I would say that that's probably the main difference just between an individual clinic and a hospital.
And I echo everything David said. It is extremely overwhelming. So it is important to be mindful about your how overstimulated you can get, because if you're in a hospital setting, it's very fast, very loud, because everybody is talking, right? So you want to be mindful about your comfort level with the external busyness. Whereas in a clinic, it's quieter, it's more peaceful. You have more time with the patients. If you're one that want to spend more time with patients, then a clinic setting is better. Okay. And you get to work with that patient most of the time on a regular basis, where as in a hospital setting, a patient, regardless of psychiatric or medically, can be in and out that unit in a few days. So it's like you're planning discharge on day one, whereas in a clinic, you have more time to plan. So if you're more of that laid back, easy, I want to take my time with that, with a patient, then a clinic is better. Not to say that clinics can't be busy, it's a different kind of busy.
And
I'll just add,
so
oh,
read the descriptions well, because there are placements that have all of that, offer both and all of those
Right,
opportunities. Sorry,
right,
Amy.
absolutely.
I would just add a little bit more as well, that I would say that in a hospital setting, acuity levels of patient need are really high. And so
Yes,
the role of social work is a little bit different, I would say, often in an inpatient setting where you're doing a lot of crisis intervention, and people are getting new diagnoses in kind of critical moments, and so the intensity is really high. I think David and Melinda were talking about that a little bit. On an outpatient basis, people still may be getting a new diagnosis, but it's not at the same level of crisis. In many cases, they may be feeling a crisis, but the intensity of kind of the environment that you're in is different. And so I think those are really important things to think about. I think also sometimes this is going to sound so raw, but sometimes it's the sights and sounds and smells that you will have in an inpatient hospital is different than in an outpatient clinic setting. And so some people have a lot of sensitivity around that. And so to be thinking about those things, those are really important things. If you are in an inpatient hospital, there can be blood and puke and, like a lot of bodily things that are happening, not even
Yeah.
just on the medical side, but on
yeah,
psychiatry side as well. So those are important things. Not everybody is equipped to be in places and feel the amount of comfort that you can feel in those situations too. So I think those are important to be thinking about. And then generally speaking, I think that this is true in healthcare in general, but healthcare work is very structured. We talk about that it's important as a social worker to be flexible and adaptable, and those are really essential skills to have in a really structured environment. So things like when a medical team is rounding at 8 a.m., they are rounding at 8 a.m. There's no, well, we'll get started in a few minutes.
right.
Like things are very structured. So again, thinking about, is that the right fit for what my style is? Or do I need something that has a little bit more fluidity to it. It's not rights or wrongs, it's just the type of environment that things are. So.
Yeah, so you can think of hospitals like a hospital placements as crisis stabilization, right? I mean, it's stabilize the crisis and get them to the next point for continued healing.
Mhm. Thanks for that question. I think I saw that there was a question that asked about any paid placements at Michigan Medicine. There is one actually, and Amy, you probably don't know about that one. I think it's only one though. David and Melinda, correct me if I'm wrong, but the Michigan Oncology Consortium placement there is a stipend for that placement. But again, that information will be in the description, but I think that's the only one. Is that true, David and Melinda?
I'm gonna let David answer that because I was not aware, but I'm still learning this role.
You are
Yeah.
correct, Amy. Yeah.
Stipends that happen so that for students is directly through that program. So it's not the student program at Michigan Medicine that facilitates that. That's not the School of Social Work that facilitates that. That is the Michigan
Blue
Quality
Cross Blue
Consortium.
Shield.
Yeah, that's them directly, but that is
Yep.
the only placement at Michigan Medicine that does offer a stipend.
Sorry for my misinformation,
Oh
y'all.
no, Amy,
But
you wouldn't
yeah.
have known. You wouldn't have known that. No,
But-
no worries at all.
But also,
We didn't even know, Amy. I had to look at the description. So.
so I just want to add on to that too. When you're in the field application, and I know we're just speaking hypothetically now because a lot of you haven't gotten into the field application yet, it does allow you to filter that out, right? But if you're only looking at paid sites, it's going to greatly limit the number of sites that that'll show up for you. So just keep that in mind.
Any other more general questions? I'll just say something about, I absolutely can appreciate financial need and the benefits of, understanding that there's so much time, 24 hours a week is not insignificant. That's a lot of time to be in your field placement. And at the same time, thinking about the investment in the learning that you would be getting and the experience that you're going to be adding to your resume for when you're going out and interviewing for positions is a incredible investment. So there's very, very few healthcare-based placements that do offer any stipend. So if healthcare is an area that you are really interested in, it's almost like that kind of reframing for yourself about the financial piece. If you're able to make that reframe, not everybody is able to do that either. So, but I'll reiterate what I said earlier, that the students have to use some elective credits for the additional time that you're in field. And I have only ever heard from students that they felt like that was a great way for them to use their elective credit. So I don't know, Amy, if you've heard similarly from students as well.
Absolutely. I think Michigan Medicine's training program is second to none. And being able to put that on your resume, not that we don't have amazing other sites elsewhere, we absolutely do, but being able to put the Michigan Medicine internship on your resume is really helpful, and their dedication to interdisciplinary teamwork and things like that it really speaks volumes, particularly if you're staying in the state of Michigan. So don't worry so much about spending your elective time doing that. I think it's worth it in the end.
Yeah.
And
It's really like you're getting additional classes. As David talked about the student program, there's clinical skills training, there's mentorships that are focused on different areas within the healthcare system. There's social justice grand rounds, interprofessional practice, there's simulations. There's so many really wonderful learning opportunities that are in addition to what a primary field placement would be. So it is a really great, again, I keep saying investment because it feels like such a great investment in learning.
yeah, and just to further break down that 24 hours 4 hours are those seminars and workshops that occur on Tuesday during the fall. The other 20 hours would be in your actual field placement. Because what I've learned is some students they're saying, do I have to do these trainings in addition to the 24 hours?
Right.
Everything is within the 24 hours. If you happen to be, one that wants to do a social justice grand rounds presentation, that's part of that 24 hours. Okay. So we will not be asking you to do anything more than the 24 hours. Okay. But just know 4 hours out of the 24 is dedicated to those mentorships, the workshops, the clinical skills training. And then the other 20 will be in the actual placement.
Great.
And
Yeah, that's a great.
just my experience, I'm a few years ago, granted, and before I know there was a big curriculum change in 2019 or 2020, but I was still able to take, I don't recall being not able to take some electives that I really wanted to take. I think, I still took some mini courses. I suspect there was probably, an elective that I wasn't able to take. I didn't go over in my credits too much. I think ended up with like 63 or something like that. But I was still able to take some electives that I really wanted to take, even with the 24 hours. So, you can still, if it's, I made it work.
Great.
Amy, there's a couple questions in chat. Elizabeth would like to know if there's any additional ways to see those descriptions for the Michigan Medicine placements, or if they'll just be able to see that in the field app.
Yeah, that will be available when the field applications open. So there is not another place to be able to view them ahead of time. It's so all students can get the information at the same time. So those will be listed. Melinda and David gave some overviews of some of them, but they will be listed really specifically about which exact placements there are, and the descriptions will be there once that field application opens. I'm sorry, it's not available outside of that. Yeah.
And then Amy, one last question here. From Adele, how long are shifts usually? Would it most likely be 2 10-hour shifts? Question mark.
Yeah, so many of the placements, it will tell you in the description what the hours are, but typically most of the placement shifts are during the day, and it's usually about 8 hours. But that is something that, like David was saying earlier, you all can get creative with the field instructor about how to make sure you adhere to the 20 hours. But I have not seen it where there have been 2 10-hour shifts or anything like that. Even for the emergency room placements that we've had. So
Yeah.
most of it, we try to make sure that you're not going to get burnt out. It's a lot. It's it's a lot of, it's a huge commitment to be in the placement and trying to learn. And I mean, there are also with our training, some of them are virtual and some of them are in person. And you may have one training in the morning that is in person, and the other one is virtual, or the first training in the morning is virtual, and then you have to get over to the main hospital or over to our outpatient clinic for the second training of the day of the morning. So it's a lot. So to have long days, it's usually not as beneficial for the learning environment. So we try to keep it um, as stressless as possible.
Yeah.
you know. Yeah.
Yeah. As an example, my student right now has 2 8-hour days and 2 4-hour days in field. And I think the same was, I think she's going to do the same thing this coming semester. I will say also, when you're looking at the field descriptions, please pay attention to, like Melinda was just talking about, the virtual and, the trainings are sometimes virtual, and the hybrid placements. Please pay attention to the placements if they say that they're hybrid, where those are, if they're on the hospital campus or if they're at the Rachel Upjohn building. Be sure you know where those things are, because if you don't have a car, you're going to be relying on the bus or shuttles, and that will impact, transportation can be a challenge, just in terms of timing. A lot of students, can figure out carpooling and how to use the bus systems, whether it's the Ann Arbor, Transit Authority buses or the U of M Blue buses. But still, it can add stress if you're moving from, campus to campus. So especially once winter comes, so be mindful of that.
Thank you. Thank you both. So we're a little after 6 o'clock now. I am happy to stay on if people have individual questions. But I just wanted to thank you all for joining us tonight, and especially thank you to David and Melinda for staying a little extra to be able to join with students. But if you have questions, you can always reach out to our Office of Field Education. We're happy to help answer your questions, and we will look forward to reviewing your field applications. Take good care.
Thank you so much, everyone.
Thank you.
Thanks, everybody.
Did